Demographics. The National Census of 2010 recorded the population of the People's Republic of China as approximately 1,370,536,875. About 16.60% of the population were 14 years old or younger, 70.14% were between 15 and 59 years old, and 13.26% were over 60 years old. The population growth rate for 2013 is estimated to be 0.46%. Although a middle-income country by Western standards, China's rapid growth has pulled hundreds of millions of its people out of poverty since 1978. Today, about 10% of the Chinese population lives below the poverty line of $1 per day, down from 64% in 1978. In 2014, the urban unemployment rate of China was about 4.1%. Given concerns about population growth, China implemented a two-child limit during the 1970s, and, in 1979, began to advocate for an even stricter limit of one child per family. Beginning in the mid-1980s, however, given the unpopularity of the strict limits, China began to allow some major exemptions, particularly in rural areas, resulting in what was actually a 1.5-child policy from the mid-1980s to 2015s. Ethnic minorities were also exempt from one-child limits. The next major loosening of the policy was enacted in December 2013, allowing families to have 2 children if one parent is an only child. In 2016, the one-child policy was replaced in favor of a two-child policy. Data from the 2010 census implies that the total fertility rate may be around 1.4, although due to underreporting of births it may be closer to 1.5 to 1.6. According to one group of scholars, one-child limits had little effect on population growth or the size of the total population. However, these scholars have been challenged. Their own counterfactual model of fertility decline without such restrictions implies that China averted more than 500 million births between 1970 and 2015, a number which may reach 1 billion by 2060 given all the lost descendants of births averted during the era of fertility restrictions, with one-child restrictions accounting for the great bulk of that reduction. The policy, along with traditional preference for boys, may have contributed to an imbalance in the sex ratio at birth. According to the 2010 census, the sex ratio at birth was 118.06 boys for every 100 girls, which is beyond the normal range of around 105 boys for every 100 girls. The 2010 census found that males accounted for 51.27% of the total population. However, China's sex ratio is more balanced than it was in 1953, when males accounted for 51.82% of the total population. Ethnic groups. China officially recognizes 56 distinct ethnic groups, the largest of which are the Han Chinese, who constitute about 91.51% of the total population. The Han Chinese, the world's largest single ethnic group, outnumber other ethnic groups in every provincial level division except Tibet and Xinjiang. Ethnic minorities account for about 8.49% of the population of China, according to the 2010 census. Compared with the 2000 population census, the Han population increased by 66,537,177 persons, or 5.74%, while the population of the 55 national minorities combined increased by 7,362,627 persons, or 6.92%. The 2010 census recorded a total of 593,832 foreign nationals living in China. The largest such groups were from South Korea, 120,750, the United States, 71,493, and Japan, 66,159. Languages. There are as many as 292 living languages in China. The languages most commonly spoken belong to the Sinitic branch of the Sino-Tibetan language family, which contains Mandarin, spoken by 70% of the population, and other varieties of Chinese language, Yue, including Cantonese and Taishanese, Wu, including Shanghainese and Suzhounese, Min, including Fuzhounese, Hokkien and Teochew, Xiong, Gan, and Hakka. Languages of the Tibeto-Burman branch, including Tibetan, Qiang, Naxi, and Yi, are spoken across the Tibetan and Yunnan Guizhou Plateau. Other ethnic minority languages in southwest China include Zhuang, Tai, Dong and Sui of the Tai-Ka-Dai family, Miao and Yao of the Hmong-Mien family, and Hua of the Austroasiatic family. Across northeastern and northwestern China, local ethnic groups speak Altaic languages including Manchu, Mongolian and several Turkic languages, Uyghur, Kazakh, Kyrgyz, Salar, and Western Uyghur. Korean is spoken natively along the border with North Korea. Sarikali, the language of Tajiks in western Xinjiang, is an Indo-European language. Taiwanese Aborigines, including a small population on the mainland, speak Austronesian languages. Standard Mandarin, a variety of Mandarin based on the Beijing dialect, is the official national language of China and is used as a lingua franca in the country between people of different linguistic backgrounds. Chinese characters have been used as the written script for the Sinitic languages for thousands of years. They allow speakers of mutually unintelligible Chinese varieties to communicate with each other through writing. In 1956, the government introduced simplified characters, which have supplanted the older traditional characters in mainland China. Chinese characters are romanized using the pinyin system. Tibetan uses an alphabet based on an Indic script. Uyghur is most commonly written in Persian alphabet-based Uyghur Arabic alphabet. The Mongolian script used in China and the Manchu script are both derived from the Old Uyghur alphabet. Zhuang uses both an official Latin alphabet script and a traditional Chinese character script. Urbanization. China has urbanized significantly in recent decades. The percent of the country's population living in urban areas increased from 20% in 1980 to over 55% in 2016. It is estimated that China's urban population will reach 1 billion by 2030, potentially equivalent to 1/8 of the world population. As of 2012, there are more than 262 million migrant workers in China, mostly rural migrants seeking work in cities. China has over 160 cities with a population of over 1 million, including the 7 megacities, cities with a population of over 10 million, of Chongqing, Shanghai, Beijing, Guangzhou, Tianjin, Shenzhen, and Wuhan. By 2025, it is estimated that the country will be home to 221 cities with over 1 million inhabitants. The figures in the table below are from the 2010 census, and are only estimates of the urban populations within administrative city limits. A different ranking exists when considering the total municipal populations, which includes suburban and rural populations. The large floating populations of migrant workers make conducting censuses in urban areas difficult. The figures below include only long-term residents. Education. Since 1986, compulsory education in China comprises primary and junior secondary school, which together last for 9 years. In 2010, about 82.5% of students continued their education at a 3-year senior secondary school. The JGAO, China's National University Entrance Exam, is a prerequisite for entrance into most higher education institutions. In 2010, 27% of secondary school graduates are enrolled in higher education. This number increased significantly over the last years, reaching a tertiary school enrollment of 48.4% in 2016. Vocational education is available to students at the secondary and tertiary level. In February 2006, the government pledged to provide completely free 9-year education, including textbooks and fees. Annual education investment went from less than $50 billion in 2003 to more than $250 billion in 2011. However, there remains an inequality in education spending. In 2010, the annual education expenditure per secondary school student in Beijing totaled 20,023 yen, while in Guizhou, one of the poorest provinces in China, only totaled 3,204 yen. Free compulsory education in China consists of primary school and junior secondary school between the ages of 6 and 15. In 2011, around 81.4% of Chinese have received secondary education. By 2007, there were 396,567 primary schools, 94,116 secondary schools, and 2,236 higher education institutions in China. As of 2010, 94% of the population over age 15 are literate. In 1949, only 20% of the population could read, compared to 65.5% 30 years later. In 2009, Chinese students from Shanghai achieved the world's best results in mathematics, science and literacy, as tested by the Program for International Student Assessment, PISA, a worldwide evaluation of 15-year-old school pupils' scholastic performance. Despite the high results, Chinese education has also faced both native and international criticism for its emphasis on rote memorization and its gap in quality from rural to urban areas. Health. The National Health and Family Planning Commission, together with its counterparts in the local commissions, oversees the health needs of the Chinese population. An emphasis on public health and preventive medicine has characterized Chinese health policy since the early 1950s. At that time, the Communist Party started the Patriotic Health Campaign, which was aimed at improving sanitation and hygiene, as well as treating and preventing several diseases. Diseases such as cholera, typhoid and scarlet fever, which were previously rife in China, were nearly eradicated by the campaign. After Deng Xiaoping began instituting economic reforms in 1978, the health of the Chinese public improved rapidly because of better nutrition, although many of the free public health services provided in the countryside disappeared along with the people's communes. Healthcare in China became mostly privatized, and experienced a significant rise in quality. In 2009, the government began a 3-year large-scale healthcare provision initiative worth $124 billion. By 2011, the campaign resulted in 95% of China's population having basic health insurance coverage. In 2011, China was estimated to be the world's third-largest supplier of pharmaceuticals, but its population has suffered from the development and distribution of counterfeit medications. As of 2012, the average life expectancy at birth in China is 75 years, and the infant mortality rate is 12 per thousand. Both have improved significantly since the 1950s. Rates of stunting, a condition caused by malnutrition, have declined from 33.1% in 1990 to 9.9% in 2010. Despite significant improvements in health and the construction of advanced medical facilities, China has several emerging public health problems, such as respiratory illnesses caused by widespread air pollution, hundreds of millions of cigarette smokers, and an increase in obesity among urban youths. China's large population and densely populated cities have led to serious disease outbreaks in recent years, such as the 2003 outbreak of SARS, although this has since been largely contained. In 2010, air pollution caused 1.2 million premature deaths in China. Religion. The government of the People's Republic of China officially espouses state atheism, and has conducted anti-religious campaigns to this end. Religious affairs and issues in the country are overseen by the State Administration for Religious Affairs. Freedom of religion is guaranteed by China's constitution, although religious organizations that lack official approval can be subject to state persecution. Over the millennia, Chinese civilization has been influenced by various religious movements. The three teachings, including Confucianism, Taoism, and Buddhism, Chinese Buddhism, historically have a significant role in shaping Chinese culture, enriching a theological and spiritual framework which harkens back to the early Shang and Zhou dynasty. Chinese popular or folk religion, which is framed by the three teachings and other traditions, consists in allegiance to the Shen, a character that signifies the energies of generation, who can be deities of the environment or ancestral principles of human groups, concepts of civility, culture heroes, many of whom feature in Chinese mythology and history. Among the most popular cults are those of Mazu, goddess of the seas, Huangdi, one of the two divine patriarchs of the Chinese race, Guandi, god of war and business, Caitian, god of prosperity and richness, Pang, and many others. China is home to many of the world's tallest religious statues, including the tallest of all, the Spring Temple Buddha in Henan. Clear data on religious affiliation in China is difficult to gather due to varying definitions of religion and the unorganized, diffusive nature of Chinese religious traditions. Scholars note that in China there is no clear boundary between three teachings religions, Buddhism, Taoism and local folk religious practice. A 2015 poll conducted by Gallup International found that 61% of Chinese people self-identified as convinced atheist, though it is worthwhile to note that Chinese religions or some of their strands are definable as non-theistic and humanistic religions, since they do not believe that divine creativity is completely transcendent, but it is inherent in the world and in particular in the human being. According to a 2014 study, approximately 74% are either non-religious or practice Chinese folk belief, 16% are Buddhists, 2% are Christians, 1% are Muslims, and 8% adhere to other religions including Taoists and folk Salvationism. In addition to Han people's local religious practices, there are also various ethnic minority groups in China who maintain their traditional autochthony religions. The various folk religions today comprise 2 to 3% of the population, while Confucianism as a religious self-identification is common within the intellectual class. Significant faiths specifically connected to certain ethnic groups include Tibetan Buddhism and the Islamic religion of the Hui, Uyghur, Kazakh, Kyrgyz and other peoples in northwest China.